So yes, again, we are Rooted LLC, and we helped Bronx Health Outreach do a doula vaccination program. And one of the things that we looked at was essentially how can doulas support pregnant folks and breastfeeding folks in getting vaccines or reducing vaccine hesitancy and misinformation. So it was really community driven and again aimed at increasing vaccination rates among pregnant folks and breastfeeding with the support of doulas. And the way in which we did this was to provide education to doulas about vaccines so that way doulas feel empowered to support their clients in offering clear and culturally relevant information and all of the benefits and safety about vaccines during pregnancy and breastfeeding. And as we all know, living through the 2020 COVID-19 pandemic, there was a lot of misinformation. A lot of folks were naturally and genuinely scared and didn't know how it would impact them or their babies. And so we really wanted to find a way to build trust, provide clear information so that way breastfeeding folks and pregnant folks could make informed decision. So it was really surrounded by supporting informed decision making and making decisions together that would be for the benefit and health of them and their babies. And doulas also really facilitate access to navigating healthcare systems, right? So you can start to have a practice conversation with your doula around vaccines before you enter into the office visit with your provider, right? And it just kind of breaks down some of those barriers to language and power dynamics. So that's why we decided to go with doulas supporting pregnant and breastfeeding folks get vaccines or learn more about vaccines. And so we did two things. We created a training for doulas so that way they can actually learn more about vaccines and the proper vaccines that a pregnant or breastfeeding person could take and that is safe and their purpose and the science behind it. And then we also created a lot of like resources. So what that looked like were offering key facts, frequently asked question, one-pagers. We created an entire practice guidebook for doulas. And I think I said scripts, but essentially we created what it would look like to talk to a pregnant person or breastfeeding person about vaccines and how you can do that in a culturally appropriate and effective way, and one that is also trauma informed and allows them to so again, just training materials and resource guides that really equipped both the doulas and the clients with education and empowerment. So these are just a few photos from the guidebook. I believe Mariah may have shared this out previously, but if you're interested, we can definitely share it out again. And then we have a list of vaccines that again are safe to take during pregnancy, which ones are not safe to take during pregnancy, and helping them understand why, live vaccine versus non-live vaccines. And again, here are just some photos from the guidebook itself. So like I mentioned, we had a frequently asked questions like one pager. We also have part of the script here on the other side of the screen, just really talking through how to respond and navigate a conversation around COVID-19 and influenza vaccines at the time. And what we found out, there were a lot of findings, but I think one of the most important parts is that doulas are uniquely positioned to bridge the gaps in healthcare access, particularly for communities who are disproportionately affected by health disparities. And that this particular program that we helped to build with you all is also uniquely designed to serve as a model for other health initiatives, right, that are aimed at improving maternal health outcomes, looking at it through a community-based lens. So yeah, that's a little bit about the program in short. And we're hoping to do another iteration of this, but now not only looking at the pregnancy period, but also the postpartum period and the newborn period, and equipping folks with knowledge of vaccines or certain health assessments that are going to come immediately after delivery, because we noticed that there was a gap of information around that. And so we're really excited to see what it looks like to take this beyond the pregnancy period and more into postpartum, adult, and newborn. So thank you.